Good morning and welcome. My name is Carol Shellcraft from the Department of Health, Immunization Education Coordinator. Thank you for joining me. Today I'm going to be responsible for your Vaccines for Children education overview. I'm going to cover the Vaccines for Children program operations, enrollment requirements, eligibility, storage and handling, the VFC policies, etc. It will not go into detail on every aspect. For example, if you need more education in the SDIAS system or log tags, I am happy to make a separate presentation for you. And the VFC is a CDC program. That is my name and my contact information should you need to get a hold of me. These are the others in my department. Tim Heath, who's been here about 25 years. He's our coordinator for the immunization program. You can ask him questions just about anything, from immunizations, log tags, etc. He has a wealth of experience. The next person is Brett Oakland. He was a former disease intervention specialist with lots and lots of experience. He became our SDIAS registry coordinator a few months ago. And so if you have questions on that SDIAS system, he does education on that. That would include inventory, different reports. He's a pro at that, so you'd want to get a hold of him if you have questions on the SDIAS system. Then Misty Pickner, you'll be dealing with her probably the most. She's the vaccine management specialist, and she's responsible for taking your orders, getting all your paperwork at the beginning of the month, sending out supplies, sending out log tags. So you can ask her anything about ordering or reports, the log tag. She's familiar with that. She does answer messages better if you email her. So that is the way to communicate with Misty. And then there's me, Carol, and I've been here about 1.5 years. So for today, at the conclusion of the training, the goals that you will be able to understand how the VFC program works, summarize the enrollment requirements, describe the VFC eligibility and screening, understand the role of ACIP, storage and handling requirements and procedures, policies, forms that are part of the VFC program. And then there's some tools and resources I'm going to give you that I think will be very helpful. And just realize your role in the fight against vaccine preventable diseases. And I have this slide up. It just demonstrates the importance of vaccines and how many lives it saves. For example, CDC estimates that vaccination of children born between 1994 and 2006 will prevent 381 million illnesses and avoid 855,000 deaths, and save money as well. Right now we're concerned with the COVID pandemic. The vaccination rates for kids have been down, so that for regular immunization, so that leaves them vulnerable to measles outbreak if they haven't had that MMR. And I want to go off on the measles tangent just a little bit because it is so dangerous, because it is so very highly contagious, much more than the COVID-19 or flu. It's so contagious that if one person has measles, 90% of the people close to that person will become infected if they're not immunized or immune to it. The measles virus can live up to 2 hours in airspace after infection. Also, after a measles infection, your immune system is decreased for the next several months, and they found that on study after study in children. I want to go over a little bit of the history of the Vaccines for Children program and how it began. Actually, it began in about 1994. There was a big outbreak of measles in the United States between 1989 and 91, which caused hundreds of deaths and many sick kids. So the government, the CDC, went to investigate to find out why all this happened, why this happened, and they found out that children weren't being immunized because of the financial barriers. The parents couldn't afford to get those vaccines. So VFC became operational in 1993. Currently, about 50% of childhood vaccines given in South Dakota are from the Vaccines for Children program. So you can imagine if that wasn't available, how many kids wouldn't be able to be vaccinated. So the way it works is the CDC buys vaccines at a discount from the manufacturers, and then it distributes the vaccines to awardees via the national distributor. Our national distributor is called McKesson Specialty. And then they send it out to the VFC providers, and then you administer the vaccine at no cost to the VFC eligible children. Although it is free for the kids, we should never consider it free. We pay for it with our tax dollars. I'm going to go over some vaccine price lists, and I go over them because of the importance of storage and handling and the money that is invested in these vaccines, and to ensure that we keep them viable for these when we vaccinate the kids. Some of the vaccines are not very expensive. You can look at the top one, the DTaP. CDC cost is $18, about $18. The private sector cost would be $32. So that isn't too bad. However, there's some, if you look at the bottom on the HPV, the human papilloma virus, Gardasil, one dose of that is $187. So quite expensive, and that's at a reduced cost. I believe there's several others. The meningococcal conjugate is $95. Pneumococcal 13 is $143.82, and that's the CDC cost. A regular clinic cost would be $236 for the clinic to order that vaccine. So the VFC program has to cover all vaccines recommended by the Advisory Committee on Immunization Practices. You will hear me talk about the ACIP quite a bit during this presentation. They provide a vital role in the VFC program. The goal, though, of the program is to save the parents and enrolled providers out-of-pocket expense for vaccine, reducing that barrier for vaccinating eligible children, and reducing the practice of having to shift children from private to public sector for all vaccines. It also allows providers to charge a vaccine administration fee. Before you can sign up or be eligible to be a VFC provider, all providers must have an initial Vaccines for Children enrollment site visit before they receive the VFC vaccines. Someone from the state, if they're new, it would be me coming out to their site and making sure that they're educated on the VFC program requirements, and that they have the proper resources to implement the program. And that would include proper storage units and temperature monitoring equipment. All of that must be in order before they receive vaccines. Normally they have to have a steady temperature for at least a few days to a week, and we need proof of that before we will ship the vaccines. The other thing that is required when you complete the paperwork is there's a provider profile and a provider agreement you have to fill out. The provider must sign all documents at time of the enrollment and then yearly thereafter. And by signing that, provider is agreeing to comply with all CDC and South Dakota requirements for participation in the program. The provider profile is kind of like a snapshot of your clinic. Estimates the number of VFC eligible and non-VFC eligible children served by the provider. It assists the provider in comparing projected vaccine needs with actual orders and inventory. The data collected supports immunization program with determining overall vaccine needs. Like I said, it is updated annually and at real enrollment, and anytime the patient population of children being served with the practice changes. For instance, if you had an influx of, say, refugees, and you needed more vaccine, then you would contact us. We would provide you with enough for that new population. The numbers also that you need for the number of vaccines go into the national level, so they know how much vaccine approximately they need to provide for the entire United States. Again, that provider agreement, you agree to comply with all of our requirements, and it must be signed annually by the medical director or equivalent in a group practice. And usually every fall, you will get a form, a new provider agreement in the mail or by email to fill out. It's usually a different color every year. And hopefully we'll have that online one of these years. But for right now, it's paper. So these are the following individuals that must be listed on the provider agreement: the medical director or an equivalent. Sometimes that's a physician's assistant or nurse practitioner. Also, all licensed healthcare professionals with medication prescribing ability. Your VFC coordinator, and that's the person that's going to be ultimately responsible for managing the VFC program at your facility. And then important too is that VFC Backup Coordinator. You must have a backup coordinator. Some places have two. You just never know when you're going to have one or two people out or more on leave for an extended period of time. It's so important to have someone knowledgeable with the program that they can step in and fill in for that person. So there are some education requirements that you as a provider and coordinators must do. All primary and backup coordinators are required yearly to show evidence of completing the CDC modules, storage and handling, and the vaccines for children you call the shots. When they do compliant visits to your facility, they may ask for your certificate for these programs. Storage and handling, and you call the shots. To set up for the program, it can be a little bit challenging. You would go to the CDC, I have a link here, and you make an account, which is free. And then you go ahead with the program, and at the end, it's kind of tricky because you have to evaluate the program before it'll print off the certificate. And sometimes the certificate might not print right away. Sometimes it's the next day. So once in a while I hear from people and they just have to resubmit that certificate again to me. We also keep a copy here. So we ask that with your monthly reports every year, with one of your monthly reports, that you send in your certificates of completion for that. And then that you keep one in your files, like I said, as proof that you have finished that for the year. I do advise people that they wait till the end of January, early February of each year to complete that training or after. They change the program just slightly every year, not much, but they usually don't have it changed until that time. Other requirements, all new primary contacts require an in-person site visit. As of right now, I am still not allowed to travel because of my COVID duties. So I am doing the education via Skype or Teams platform. Others in your organization should be trained on the role they may perform, such as receiving shipments. If they're going to receive shipments, they should go through the education of storage and handling. This is an example, or the page of You Call the Shots, and you can sign up for continuing education, but for us it is not necessary. We just need that certificate. One of the things that you have to know here is the VFC Eligibility Categories. So it's for children when they're born through the day before their 19th birthday, and you have to meet one of these criteria: Medicaid enrolled, uninsured, American Indian or Alaska Native, and underinsured. And we're going to talk about underinsured in a little more detail in just a minute. So the underinsured child, it isn't as common as it used to be because many insurance policies now cover vaccines. However, there are still some old policies out there that do not cover vaccines or only cover some vaccines. So a child who has health insurance, but the coverage does not include vaccines, they would qualify for the VFC program. However, one caveat, they must get those vaccines at a federally qualified healthcare center, rural health clinic, or South Dakota Department of Health Community Health Office. Otherwise, all the other VFC eligible children can get them at any clinic. You're responsible for doing that VFC eligibility screening at each immunization visit for all patients birth through 18 years old. And that status must be documented at each immunization visit, even if there's no change in eligibility status. And again, keeping those records, you're responsible for keeping the paper records. Anything you send to Misty and us for your monthly reports, you also have to keep a copy. So we're going to go over to more on the advisory committee immunization practices. They're a group of people, experts, doctors, scientists that belong to this group. They cannot have any ties to any pharmaceutical company. And they meet and go over scientific data and determine the vaccines we use, the number of doses, the way we space them apart, even the makeup schedule. They make that based on scientific data of how the immune response works and what age and is the most effective at. They also provide specific recommendations to include a vaccine in the VFC program, and those recommendations are written in the form of a VFC resolution. Just another note on the ACIP, They are also responsible for overseeing new drugs for adults as well. All immunization schedules for adults and vaccinations for adults in the schedules they are responsible for. And so after a resolution is in place, the CDC establishes a contract for the purchase of the vaccine through our program. And the resolutions, if you're interested, are on this website. As a VFC provider and signing the agreements, you agree that you must offer all ACIP recommended vaccines for the populations they serve. You can't pick and choose and decide to give the child a DTaP that day and not give them a MMR because you're afraid of the side effects. You have to offer all those vaccines to the VFC eligible children. And also you agree to comply with the immunization schedule, dosages, and contraindications that are established by ACIP and included in the VFC program. And for example, if they say you need 2 flu shots, and the doctor wants only 1, but that's VFC vaccines, they need to follow the immunization schedules unless there's a medical reason why they can't. But you are responsible for following those immunization guidelines. There are exceptions, as you know. There are medical exemptions for which are the provider's medical judgment in accordance with accepted medical practice. It deems the vaccine medically inappropriate for the child. Maybe that child has HIV or some other medical condition that would be contraindicated. And the other exception we have is by state law is a religious exemptions. And that is stating that your religious beliefs contradict getting these vaccines. And I will tell you, since the COVID outbreak, we have seen an increase in religious exemptions, particularly the kindergarten group. And that seems to go up a little bit every year. There's a lot of misinformation out there. So one of your responsibilities is getting correct information out to patients and their families. So every year, as you know, a new vaccine schedule comes out. It usually doesn't come out till February, March, somewhere in there. You are responsible for printing that off and having that accessible in your vaccination or immunization room, or in every room. Some have that done. It breaks it up. On this page, they're going to give you what vaccines are recommended for children, the abbreviations, and the trade names. So you're going to determine recommended vaccine by age, and then determine recommended interval or catch-up interval. We'll go to table 2 soon. And then assess needs for additional recommended vaccines by medical condition and other indications. And then review vaccine types, frequencies, and considerations for special situations. So this is the 2021 recommended child and adolescent schedule for ages 18 and under. I think it's pretty easy to read. It outlines when these vaccinations should be given. I think the tricky part is a lot of kids don't stay on schedule for various reasons. So this table is great when they're on schedule, but it takes a little more time when they're not up to date. So they do have the recommended, on table 2, the recommended catch-up immunization schedule for children and adolescents. And so I would if you don't have this, I would recommend you copy this from the CDC. I'll talk about other sites where you can get this. We can send you a copy if need be. We used to send out laminated copies. We usually don't anymore because of cost, but I can provide you with some of these, at least paper form. This is Table 3, the Recommended Child and Adolescent Immunization Schedule by Medical Information Indication. For instance, if you have a child with HIV infections and the CD4 plus count is less than 15, absolutely not. You would want to not give that influenza vaccine, measles, mumps, or varicella. You would not want to give a live vaccine. So it just groups those into categories for the healthcare provider to see what immunization would be appropriate for that child. This is another CDC handout. And when we get into the vaccines that have multiple vaccines, it gets a little tricky. But this particular table lists the vaccines and, again, the trade names for those vaccines. Scroll down just a bit here. And this is a list right now of the combination vaccines and the trade names. And in that CDC section of the schedules, these are the notes that come with it. They're color-coded. And for instance, if you have a child who hasn't been vaccinated for DTaP, you can go to this table and it will help guide you through that process of when to give another dose. These are my favorite catch-up tables, but they're only good for certain, they only have them for certain vaccines and for certain age groups. But for instance, if you had a 7-month-old that has never been vaccinated with the pneumococcal, you'd follow across here. So 0 doses before. So you'd give 1 dose today, and then the next dose would be give dose to it 4 weeks after dose 1. So it just really spells it out for you, and I wish they had this for every age group and every vaccine, but they don't. And here's just another example of that. That goes 24 through 59 months. And this is color-coded. This is another one for a DTaP. So if they're 1 year old and they've had 1 vaccine, 1 DTaps, excuse me, and they have had none, you give 1 dose today, and then you go on over and give dose 2 at least 4 weeks after dose 1. So it really helps take the guesswork out of it. These are just other examples of those that are on the CDC website. So this is a table that you should have as well. It's the recommended and minimum age and intervals between doses and routinely recommended vaccines. Say for instance, so we'll go to Hep A. Recommended age for the dose is 12 to 23 months. The minimum age would be 12 months. The recommended interval would be 6 to 18 months between vaccines. The minimum interval would be 6 months. I use this daily, or more than daily usually, but this is important to have with your vaccine tables. This is an example of a parent-friendly version of recommended vaccines, and this is on the CDC site as well. Just want to go back. There is one new vaccine that is coming out in June. It should be available in June for the VFC program, I'm told. It's called Min-Quad-P. It's from Sanofi, and it's a meningococcal conjugate vaccine, groups A, C, Y, W, and it's approved for individuals 2 years of age and older. So I just wanted to mention that. That is a new one coming down. These are some tools, websites on the schedules that are helpful. The pink book is listed at the bottom. That's kind of the Bible of vaccination information. It's very helpful, and particularly the appendixes. Some other really good information. I have downloaded these on my phone. They are free. This one is the Cdc Phone App. Lots of information on it. It's just great if you want to look up the schedule. This is how it looks like if you'd open one up. And you can press on different buttons if you want the schedule. If you want the child, adult schedule, you can bring those up. Also, the vaccine information statements would be on there that the parent could read. They have the catch-up schedules, the adult schedules. Any changes in the schedules will be released through there. So it's really handy to have. I use it on my, I bring it up quite a bit on my phone, especially when you're out in public. If someone knows you're a nurse and wants to know when their child is due for a vaccine, you can bring this up on your phone. I have to say this is my favorite app, though. It's from the Children's Hospital of Philadelphia. Lots and lots of great information. The Children's Hospital is well-renowned for their vaccine research. And this app is called Vaccines on the Go, What You Should Know, the mobile app. It is also free. It goes more into the diseases and the vaccines and the diseases they prevent. The schedules, of course, are on there, but it does go through many parent concerns such as autism, thimerosal, the child getting too many vaccinations at one time. It also has some great information on the immune system, some travel information. And by the way, if you get travel questions, I used to when I worked in the clinic quite a bit, I'm going to this country or that country, what vaccines do I need? The CDC has a wonderful site that you just put in the name of the country and the recommended vaccines will come up. But in this program too, the Children's Hospital of Philadelphia has this information as well in this phone app. There's also videos, animations, how the viruses attack cells. There's short videos, vaccine trivia, a lot of information. I have this one on my phone as well, and I find it very helpful. The other resource that is invaluable for me is the Immunization Action Coalition. And if you're not signed up for the newsletter, which is free, I would encourage you to sign up. I use this site daily, if not more than daily, for my vaccine questions. Also, it has some films. It has COVID information. You can print your VISs, your vaccine information statements. Any handouts, about vaccination concerns for the parents. What I use it for mostly is for Ask the Experts. This is a wonderful site you go to within that site, And so if you have a question on, say, MMR, you would press that MMR right there, and it would bring you to a page like this. And the upper page will talk about the vaccine and the schedule, but the lower part will have very common questions asked by a lot of providers. What should I do if this happens or that happens? Most of the questions are in there, so it's a great resource for everyone. And this is just what the pink book looks like. And the supplemental, you can print off the supplemental tables there. So we're going to get back into the VFC record retention. As I said, all your records must be kept for 3 years at least, and they must be available to all public health officials when they request them. So if the state comes in and they want to see your log tag records, then you have to provide those for them. These are the types of VFC records that I'm talking about. The temperature logs, which you write twice a day, you write in the temp. Data logger reports, like I said, the log tags. The inventory records, eligibility and agreements, storage and emergency plans, billing records, vaccine orders, purchase and accountability records. And as I said, the VFC vaccine itself are free. However, you are allowed to charge an administration fee. And for non-Medicaid patients, American Indian, Alaska Native, uninsured, underinsured, VFC providers cannot collect an administration fee in excess of $20.73 per vaccine, not per antigen. If there was 4 antigens in that vaccine, you could only charge the $20.73. And that is a fixed rate and will not change. If it does change, we notify you, but otherwise it can increase like other costs on clinics and hospitals on a yearly basis. It has to stay at $20.73. And then for Medicaid, I believe the reimbursement is less than $10, but that is also set by the South Dakota Medicaid, and also not per antigen. If there's 4 antigens in that injection, you can only charge for the 1 injection fee. So there are some rules, administration rules. You cannot deny vaccine to a VFC eligible child due to the parents' or guardian's inability to pay for that vaccine administration. The only fee that must be waived is the vaccine administration fee. So if you have doctor's visits, lab tests, things like that, those can be billed. You can bill them for the administration fee. However, you can never take them to collections for it. Another thing that you're required to do is give the patient or family a vaccine information statement. That's a federal law. You must provide it before each dose of the ACIP vaccinations. Even with the multi-dose series, you can pull each antigen out of those VISs and give them multiple ones. So they have 1 VIS for each antigen. So another thing you are required to do, you are expected to maintain an adequate inventory of vaccine for both the VFC and non-VFC patients. There are times it is not encouraged when you need to borrow from your private stock. For instance, you have a child there that you feel is not going to be, you won't see again in 3 months for the next vaccine, but your VFC supply is out of MMR. So you borrow an MMR from your private stock, and then you replace it as soon as possible. And vice versa, if you're private, if something's going to expire quickly from your VFC and you use it for private, you must replace that. And then there's a form you must fill out. There are times when you have to use it. However, like I said, it's not encouraged. And you want to replace that borrowed vaccine as soon as possible. And you will send that report in with your monthly reports, the borrowing report. And federal law says you must maintain immunization records that include all the following. And you know, when we put in an immunization into the SDIS system, you know, it really, or into our EMRs, it's going to bring these up for us to put in the vaccines, the date of the vaccine, the date the VIS was given. Publication date of the VIS is very important because those change, so make sure you have the most recent VIS. The manufacturer vaccine lot number is very important. Of course, your name and the address of the clinic. And then we're going to talk about the VAERS reporting system. You've probably all heard of this, but it's something we need to go over. The National Childhood Vaccine Injury Act requires healthcare providers to report certain adverse events to VAERS, or the Vaccine Adverse Event Reporting System. And adverse events are defined as health effects that occur after immunization that may or may not be related to the vaccine. These reports can be filed by anyone. It can be the patient, it can be the doctor, the nurse, a teacher. So there are limitations. It's not exactly scientific data, but it does give them important information about patterns. For instance, if there's a lot number and they're seeing more side effects with that certain lot number, that would give them information on that. But you as a healthcare provider you have to report those adverse health side effects. And it's easy to report. There's a website on the SDIS site. There's a small link you can see. There's phone, you can call them. The nice thing is they determine whether it's related to the vaccine or not. It's not something we have to determine. Our job is to report the adverse event. And when you report to VAERS, this is what they're going to want to know. The vaccine, the timing of the vaccine, date of onset of the adverse events, current illnesses or medications, the history of adverse events. For example, if they've had adverse events before relating to a vaccination, age, gender of the recipient, etc. Another thing, are they receiving current treatment of some sort, cancer treatment or something like that? It doesn't hurt to report details, even more details, even though you think they might not be important. The CDC may find them valuable. The other recommendation is that you have to have vaccine storage units that are proper and will keep the vaccines at the proper temperature. There are pharmaceutical grade standalone or combination units, household commercial standalones, or household commercial combination units using the refrigerator. You must have enough space to store your largest inventory. Say, during influenza season, you have a lot of those influenza vaccines. You must have enough room to fit all those and your other vaccines and maintain some space, proper space between the vaccines. You must maintain a proper temperature at all times to keep that vaccine viable and effective. And And then you have to be protected from disconnection from a power source, and I'll go over some things about that in a little while here, how you can prevent that. A lot of places have a pharmaceutical grade standalone, which is wonderful. They do seem to keep the temperatures much more stable, but many clinics can't afford that, so they have a household one. And if you have a household standalone unit, you can use the refrigerator, but you can't use the freezer, or vice versa. You have to use one or the other. On those kind of situations, most clinics would use the standalone refrigerator, and then they would buy a small freezer separately. You absolutely cannot use dormitory-style refrigerator or freezer units for vaccine storage at any time, including temporary storage. They do not hold steady temperatures. They can freeze vaccines that shouldn't be frozen. They're just absolutely prohibited by the Vaccines for Children program. Another requirement is that for temperature monitoring, which you should have to do continuously, is that you must have a digital data log or log tag. That comes with detachable probes for monitoring the temperature. Most people get the log tags through the state, and I'll show you a picture of that in a minute here. Some places have their own log tags, and some places use their own plus ours, but I would say the majority of people do use our log tags. These are the log tags that we currently have. There are some old blue ones out there, but these are the ones that we send out. So on the temperature monitoring documentation requirements, all providers must show on paper the date, time, and initials. You're going to read those temperatures in the freezer and the refrigerator twice a day, morning and night, and before you go home at night. The refrigerator temp should be between 2 and 8 degrees Celsius, and the freezer between -50 and -15. The CDC also recommends recording a min-max temperature daily, and that gives you the minimum and maximum temperature of that refrigerator or freezer for the last 24 hours. And it also records the min-max for the last 3 days. It's a matter of pressing the right button. When you get a log tag, or if you have them, they come in a small box and they will have this calibration certificate. There will be a calibrated date and then a place where it says next calibration date. You want to keep this in the either in the box or by the log tag. When the state comes to visit, they can ask for these certificates. So if you just keep an eye on those dates when they're due to be calibrated next, they do outlast that date. However, I recommend that you replace it before. You should have a log tag for your freezer, your refrigerator, and then one backup log tag. One log tag is programmed for the refrigerator, one is programmed for the freezer, and the backup is not programmed for either because the batteries went out very quickly. So we include steps that show you how to set that up for the refrigerator or freezer. And if you have difficulties, you can call us and get direction as well. So what do you do if you have some expired vaccines? First of all, you want to remove them from the storage unit to prevent anyone from administering those expired vaccines. You want to place them in a container, get them out of the refrigerator. They don't need to be refrigerator frozen anymore. And the certain vaccines that are expired, the CDC will get a tax credit for. So we usually have you hang on to them and then contact Misty or email Misty and let her know that you have some expired vaccines. She, in turn, gets a hold of McKesson. McKesson sends out an email that includes a package slip for you to send back. I will tell you that McKesson can take up to a month to send those expired vaccine emails out. So just be aware of that. So the vaccine storage and handling, to understand the cold chain, that is the system we use to describe between the distribution, the making of the vaccine, and maintaining those temperatures at an optimal temperature. It begins with the cold storage at the manufacturer, extends to the transfer of the vaccine to McKesson, and then to your office, and then to the patient. And I know this was covered before, but I can't express how very important it is to keep the vaccine viable and effective by keeping it at these temperatures. CDC does prefer Celsius, but for the refrigerator, aim for about 5 degrees. For the frozen temps, aim for about 0 or -18. And again, it depends on the vaccine. For instance, the COVID vaccines, that's a different story. For some of them have to be ultra cold or a little colder than the normal frozen temperature. So what do you do if there's a failure, if you suspect a storage and handling cold chain failure? Well, first of all, make sure you have your emergency plan right there where you keep the vaccines. Who to contact, who your main coordinator is, the secondary coordinator. Get the vaccines out of there and in your safe secondary emergency storage place. That is if the temperature is still not correct. If it is correct when you find it, but the alarm had gone off, what you want to do is download that log tag report immediately and see how long that vaccine was, if it was out of temp range and for how long. Do not administer the vaccine, do not discard it, put it in a bag that says both of those and put it, if that refrigerator or freezer isn't back to normal temp, then get it in your emergency refrigerator or freezer. I wanted to say just a little bit more on that. You can contact the state for questions on that. There's a form that you fill out for temperature excursions. Also, you want to call the manufacturer of the vaccine or vaccines that were affected, and they can guide you through if that vaccine is still viable or not. In the past, I've noticed sometimes it's okay if it goes out shortly for one instance, but the second time that happens, the vaccines will no longer be viable. So receiving, when you get those vaccines, you want to make sure you open the packages immediately, expect for damage. Look at that temperature monitor reading. Make sure that what you ordered is what you get. Once in a while, there's an order mishap. Last year we had some frozen vaccines that weren't supposed to be frozen, so they had to be sent back. Just get that box opened immediately and into proper storage temperatures. And this again just goes over how to unpack. You want to store the vaccines in trays or uncovered containers for proper airflow. Put the vaccines that are going to expire in the front. You want to leave the vaccines in the original boxes with the lids closed to prevent exposure to light. You want to make sure, very important, to separate and label vaccines by type and via public or VFC stock. Many places will do it on different shelves and have bright stickers that identify VFC and private stock. That's helpful when you're in a hurry and reaching in that fridge to give a vaccine for a patient that's there right now. The other important thing, especially when you have temperature excursions, is placing water bottles, having water bottles on the top shelf, floor and door of a refrigerator. Some of the pharmaceuticals don't have door shelves, so you don't have to worry. And this is especially important with the standalone commercial refrigerators or freezers. They maintain a stable temperature for frequent door opening in the event of power outages and equipment failure. I've had several cases where the electricity went out on clinics that didn't have backup generators. They were able to save their vaccines because of the water bottles, keeping it at a consistent temperature. So the main reason for temperature excursions is the vaccine door being left open. Many of the new pharmaceutical grades have an alarm that goes off if the door is not shut. So just make sure the seal of your refrigerator or freezer is good and that it doesn't bounce back. Because when you're in a hurry and you slam that door and it can bounce right back. And you might not notice. You want to leave 2 to 3 inches between vaccine containers and refrigerator walls. You replace the crisper bins with water bottles. You want to put do not unplug signs. You see to the right side by the plug-in there. Do not unplug, very important. I did have a long time ago an instance of a provider. They were not open on the weekend, and the housekeeping crew came in and decided they were going to get the carpet cleaned in the injection room. And so they unplugged the refrigerator and did not plug it back in. And they lost tens of thousands of dollars of vaccines because it was over a weekend. So just keep that in mind. No beverages or food in the refrigerator, of course. You don't want to store vaccines on the side or the top under the vent if it's a commercial standalone freezer. This just goes through the best practices for the freezer as well. We don't want to block the air vents. Don't use the dormitory style fridge. Get that do not unplug sign up. And this is step-by-step for handling a temperature excursion. And this is available at the CDC as well. And you might want to put it with your policies and procedures. So this is a temperature excursion form that the state has right now. And you wouldn't wait till to submit it with your monthly reports. You would want to send that in right away. They are going to ask you for data when you call the manufacturers, the ambient temp, what happened, how long the temperature was out of range, etc. Then we have VFC policies. We were starting to redo these before the COVID hit, and we haven't had a chance to get back to them. But these are in your VFC manuals. You should have a VFC manual in your clinic. It's usually white. If you don't have one, can't locate yours, please let me know and I'd be happy to send you one. There are old ones out there, and you'll know they're old if the policies say number 001 or 002. The newer ones are 01 until we make the new policies. This is just going through the staff that you have to have the primary and secondary backup coordinator. All changes must be communicated with the state, changes of, especially with the primary coordinator, but also the secondary coordinator, because the CDC mandates that we have to have education for all new coordinators. Again, to go over the importance of the storage and handling management plans, the importance of having that written plan for routine storage and handling and emergency relocation. Each staff that administers vaccine should know where your emergency relocation is, or at least you just have that policy up there on your refrigerator or freezer. Plans should be looked at yearly and updated as needed. More information at the storage and handling toolkit on the CDC site. There are monthly reports that are required, due by the 5th of the month, and that's regardless of whether your clinic orders every month or every 6 months. You still have to turn in these reports every month. The dose report, clinic inventory with the temperatures, written weekly log tag reports, monthly provider certification forms, vaccine wastage reports, order form if you need supplies, and of course, at least once that year, you need to put your certificates of completion for the CDC modules. You want to make sure that all your information is on every sheet, your provider ID and clinic name on all forms. This helps speed up the process of your order. And as you can imagine, Misty gets a lot of faxes during the first of the month. So it is a CDC requirement that there be visits, compliance visits at our VFC provider sites. The good thing is these site visits are more to educate and support. They're a very opportunity for learning and to help the provider. We want you to be successful and be able to keep giving VFC kids vaccinations. We want to make sure that you're educated well and meeting the requirements for patient screening, documentation, proper storage and handling. The visits usually happen yearly. With COVID, they've gotten a little behind. So they will be resuming soon. Most of the majority of the time, they are scheduled with you. It's beneficial to have at least your primary coordinator there, if not your secondary coordinator. And this again just says it gives you an opportunity to really get some more education on the vaccines and the Vaccines for Children process. If you have issues or problems, we'll work with you to establish a follow-up plan and get you back into compliance. CDC requires that we do 5% unannounced visits. So there are a few places that will have an unannounced visit during the year. Again, the goal is the same, to provide education and make sure you're compliant with temperatures and all policies of the VFC program. There are fraud and abuse policies too. The big difference, fraud is the intentional deception or misrepresentation by a person, and abuse can be more practices that are inconsistent or because of lack of knowledge, not necessarily intentional. These are some examples of fraud and abuse. Providing VFC vaccine to non-eligible VFC eligible children, billing a patient or third party for a VFC vaccine, charging in excess of that administration fee that is set for South Dakota, denying a VFC vaccine due to inability to pay, failure to maintain records, a large amount of waste of VFC vaccines. These are all listed in your VFC manual. This is going over more fraud and abuse. Just saying if there's non-compliance, we'll provide additional education and training so we can get you back in compliance. So why vaccinate? I think it's very simple, saving lives. I think part of the issue today is that people have forgotten what these diseases look like because of the effectiveness of vaccines. We've eradicated some diseases. And I remember seeing people with polio and how crippling that was. But because of vaccinations, people don't see that today, and kind of out of sight, out of mind. And so there are pictures on CDC that demonstrates what these diseases look like and how crippling they can be. And that's why we worry so much about just the routine vaccines that have been down for the past year in children. That, for instance, a measles outbreak could resurface and spread very easily. Vaccines can save up to 42,000 lives every year in the U.S. alone, more than 3 times the seatbelts and child restraints combined. Those are important too, but it's astounding how many lives they estimate that vaccines save. This slide always makes me sad. Every year, 1.5 million children die because they weren't vaccinated. That is true mainly in undeveloped countries. But in the U.S., we have the vaccines. So we have no reason for kids to die because of these diseases. And don't underestimate the importance of you and your staff, the role you play in vaccine preventable diseases. You become a trusted member of the extended family. You build relationships with that family through the lifespan. Maybe you see them and then you see their children's and their children's children. Nurses and related fields are one of the most trusted people in the public eye. It doesn't mean that they're going to trust, all families are going to trust you, but most generally your advice is trusted. So if you give a very strong recommendation for vaccine, for example, I had my kids take this vaccine and I'm so glad I did. They hear that and they're more likely to agree with their child having that vaccines. So your opinion really does matter. You might have to spend a little extra time with people who have questions, and that's very important. There's some people on the fence that have been given wrong information. So if you could supply them with some good information, accurate information, or at least accurate websites where they can find accurate information. We don't want to ever forget about the adolescence vaccines, the Tdap, the HPV, or the meningitis. As I said, there's a new meningitis vaccine coming out, MenQuadFi, and we expect that available in June of 2021 through the VFC program. So when I was a clinic nurse, I would come in the room if that person or teenager was due for these 3 vaccinations, I would come in and I would say, today you're due for the DTaP, HPV, and meningitis shot. And most often, I would go ahead and give that without objection. Sometimes the parents do object to the HPV. The common excuse I found was that if they give them the HPV shot at such a young age, 11 or 12, it is giving them permission to be promiscuous. And if you can educate them that the right reason is because of scientific studies, years of scientific studies prove that the immune system is more robust at ages 11 and 12 to accept that HPV vaccine. If you can just supply facts, I think that helps a lot. And then the meningitis vaccine, very important, as well as the meningococcal B vaccine. I know we gave that to most of our patients, especially those going to college, but we did advocate it for all. So HPV not only causes cervical cancer, rectal cancer, but is a major cause of oral and pharyngeal cancer. So one of my favorite quotes from Nelson Mandela, life or death for a young child too often depends upon whether he or she is born in a country where vaccines are available or not. And we're fortunate enough in this country to have vaccines available. These are references. And to those of you who are watching this, there is a post-test to complete. I would ask that you complete it within a week of viewing the presentation and then send it in to me via email or fax. That concludes the 2021 VFC Education presentation. Thank you for joining me. And for the ones that are live today, please stay on the line and I can answer any questions. This is posted on the website, the presentation on the South Dakota Department of Health website. Thank you for joining me, and like I said, the ones that are with me live today, please stay on. Hello, Jeff? Is anyone there? Any questions from anyone today?
This is Tammy. I have a quick question. I don't know if you can help me, but I'm guessing you can lead me in the right direction.
Sure.
When I was signed up on the SDS's website, my last name is spelled wrong on there. So okay. I don't know who I need to contact to get that changed, but
I will have Brett contact you. Tammy, what's your number?
I work at, or do you want my clinic number or email or?
What's easiest for you?
Either way, I can give you the phone number to the clinic to contact me.
Okay.
It's 942-7711.
And remind me of your last name?
It's Weich.
Okay.
And on the website, I believe it's WELCH.
Yeah, I saw that too. So, okay. And do you guys have a manual there? A VFC manual?
I am guessing we do. I'm not in that room right at the moment.
If you don't, would you please contact me?
Sure.
And I can send out one.
Sure.
Is there anyone else out there that's participating? Any other questions? Remember, if you need more SDIS training or log tag training specific, I can arrange that. So don't be afraid to reach out on that. that, if there's no more questions, I thank you again for taking the time out of your really busy clinic schedules. I know how it is as a nurse, being a nurse in a clinic for 13 years. It's crazy busy, and so I appreciate your time, and I appreciate you taking on being a VFC coordinator. Thank you.